So let's talk about a couple pathologies associated with the cutis and also repair and regeneration. So acne is just due to plugged sebaceous ducts. This happens during puberty because they become active and very overactive during puberty, and all of that excess activity can block the pores of the glands. Treatments include things like benzoyl peroxide or salicylic acid, and if it's severe enough and untreated, it can lead to scarring. Now, when we look at our cutis, remember the epidermis is constantly creating new cells from the stratum basale. And so if you damage the epidermis, then it's not a big deal. It's going to completely regrow itself and look exactly as it did previously. If you go down further into the dermis, then it gets a little bit trickier. So the regeneration is just a replacement of damaged or dead cells, and it's going to restore the function of the cutaneous membrane. If the damage is extensive enough, then we're going to start to get a lot of collagen fibers kind of laid down haphazardly in the area to help reinforce and secure it, but we call that scarring and fibrosis. And function can actually be not as good as it used to be. So with wound healing, what happens is a cut blood vessel will bleed into a wound. So because it's bleeding, we're clearly down past the epidermis and at least down into the dermis, if not the hypodermis. So as the blood vessel bleeds, it's eventually going to form a clot. And because you're leaking both red and white blood cells into the area, they can clean up the wound, and it forms a temporary barrier against pathogens. The blood vessels are going to regrow through the area pretty rapidly, and we're going to get some kind of cruddy tissue called granulation tissue. It's vascular, it's kind of a connective tissue, it's not very strong, it's just a stopgap measure that's a little bit stronger than a clot. As the epithelial membrane regenerates and repairs itself, the connective tissue is going to start to fibrose. We're going to start lacing new collagen fibers through the affected area to help reinforce and strengthen it. But if the area is extensive or in certain places of the body and you don't go to physical therapy to help stretch those as they're forming, then the area will be contracted and you'll lose function. So wound healing depends on the extent of the injury. Obviously, things that are more severe, that are wider or deeper, are going to need longer to heal. If they're very severe, they might not return to their original condition. Things like hair follicles, the exocrine glands, or the nerves, the erector pili muscles might not be repaired. It's fairly common for somebody to have severe burns and then no longer be able to sweat from that particular area because they've destroyed their sweat glands. So here's some of those stages in wound healing I talked about. The initial one here is our wound up at the top left. We've destroyed the epidermis and we've gone down into the dermis, destroyed some blood vessels, and now the wound is filling up with blood. Eventually it's going to clot, and we're going to have some white blood cells, these little macrophages. We're going to migrate into the area and actively not only clean up any cellular debris, but they're also going to be hunting bacteria and viruses. Now you notice that the epidermis here has been severed. And that's a problem because we have to grow back from the epidermis, or from the stratum basale. So what happens is the stratum basale actually starts to grow down and will eventually grow all the way across and bridge that damaged area. As you can see here, we've pretty much bridged it. After that, after it grows laterally across the wound, then it can start to grow vertically and to fill up the area. So that's what we see here, is the epidermis is regenerated. Now you'll notice that the epidermis in this region is much thicker than the epidermis in the surrounding area. Now partway through the process, you'll notice that we're having some of these little fibroblasts migrate in. And these little guys make collagen. So we're going to get a whole bunch of them, and they're just going to start spinning new collagen fibers that are going to crisscross through the area. Remember, collagen doesn't stretch very well. And so if it kind of sets up then this area won't be able to be stretched. And you have what we call fibrosis because of all the fibers, and it's also known as a scar. If you go to therapy, and as that connective tissue is forming, as those collagen fibers are maturing, if you stretch that, one, it doesn't feel very good, but two, the fibers become much longer because of the stretching, so that when you're done healing, you'll have a lot of function left back in that area. Psoriasis is an autoimmune disease that affects the skin. The keratinocytes are attacked by T lymphocytes, and this causes kind of a rapid overgrowth of new skin cells. You get patches of whitish, scaly skin on the surface of the epidermis, and that causes severe itching and pain and can cause cracking in the skin. There's all kinds of treatments, corticosteroids, UV light, and now they've got some what we call monoclonal antibodies for it. Skin cancer is interesting. Most skin tumors are benign. That means they don't metastasize. So yeah, it's a growth and we don't like it, but it's not going to spread. Risk factors for skin cancer include overexposure to ultraviolet radiation or frequent irritation of the skin, such as windburn. Some lotions can actually contain enzymes and liposomes that can help fix damaged DNA. There are three major types of skin cancer. There's basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most common and the least malignant, so that's what we call a really good prognosis. Squamous cell carcinoma is the second most common. It too is fairly benign. Melanoma, on the other hand, can be very, very dangerous. It loves to metastasize, and I've personally known people who have died of melanoma. Luckily, in the last 5-10 years or so, treatments for melanoma have come quite a long ways. So basal cell carcinoma comes from, you guessed it, the stratum basale of the epidermis. Here you can see a nice lesion on this person's nose. And surgical excision or cutting cures about 99% of the cases. Now, we can't say 100% in medicine because there's always going to be that one person who doesn't get better and then ends up suing everybody. And so medical professionals always say like 99%. Squamous cell carcinoma comes from the stratum spinosum, just up from the stratum basale. This is most common on the scalp, ears, lower lip, and hands, which are all places that have excessive exposure to sunlight. If it's caught quickly and treated with radiation or removed surgically, the prognosis is really good. This doesn't really tend to metastasize very much. These are also known as rat bite lesions because they faintly resemble the size and markings of the bite of a rat. And then melanoma. Melanoma involves the melanocytes. It's highly metastatic. It spreads very easily. It's very resistant to chemotherapy. It's treated by a wide area of surgical excision and immunotherapy. So you can see here, this one is, a good 20 or so millimeters long, probably 10 to 15 wide, and it's looking pretty trippy there. So let's look at the ABCDE rule for melanomas. We're looking for asymmetry. Does the lesion look symmetrical? In other words, is it the same on each side, or is it asymmetric? Is the border regular? The color can be anything fairly dark, brown, tan, red, black, blue. Diameter bigger than 6 millimeters, which is about the end of a standard pencil eraser. And then evolution is how it's changing over time. Is it getting bigger? Let's go back one slide and look at this thing. That's clearly bigger than 6 millimeters. Remember, it's at least 20 or so long, so that's a big mark against it. It's asymmetric. I mean, it's got this, almost looks like a fried egg. It's got this yolk over here, and the border is very irregular. It's all over the place. It's a very dark color, and so it's hitting all of these check marks, right? It's asymmetric, irregular border, It's a dark color. The diameter is much larger than 6, and so that's really clearly filling out 4 of the tick boxes for a possible melanoma. It needs to be checked by a dermatologist. Here's a bunch. There's no rulers here, so we can't really tell how big these things are. But like this one here, it's clearly the border is irregular. It's asymmetric and dark, so that's at least 3 of the 5. This one here is very dark. The border is a little bit irregular. It is symmetrical. But like this one here, yeah, not good. So let's talk about burns. Burns are when the body is exposed to not only heat, but radiation, chemicals, sunlight, or electric shock. All of these will cause burns. And the major problem with burns is loss of life from 1, bleeding, but 2, infection or renal failure. So first-degree burns involve only the epidermis. There's a little bit of redness, there's some pain, and usually just cooling the area in some cool water will be fine. Usually caused by too much sunlight. Second-degree burns are more extensive. They go down through the dermis and into the epidermis. You're going to have blisters. Blisters are a hallmark of second-degree burns. It's also going to be extremely painful. And if it gets infected, you're going to have some scarring. If there is no infection, then it typically will heal without scarring. You can see here some really extensive scarring on, looks like a child here. Here's the gluteal fold, their butt cheek, and you can see that the whole right side of their body has some pretty extensive burns on it. This is usually from either burning clothing or hot liquids. So it's classic to have a child in the kitchen reach up and grab a pot handle and pull a pan of hot water down on top of themselves. So make sure you turn your pan handles in. And this is a third-degree burn. So the third degree goes all the way down through the dermis, or I'm sorry, all the way down through the epidermis, down through the dermis, and into the hypodermis. These are actually not painful. That's because you've burned away all of the nerve endings. Now, to be clear, the area that you see here is going to be painless, but like this area here and this area here, these are where we're going to have second-degree burns, and there's going to be second-degree burns all along the margin here, and those will be extremely painful. But all of this area in here, that's all hosed. All that yellow stuff, as soon as my blue squiggle fades away, all that yellow stuff in there is hypodermis. That's all fat, adipose tissue. And then the red you see here and here, that's actually muscle. So they've burned away even the hypodermis and some of these regions. This is going to require hospitalization, treatment for dehydration, treatment for infection, additional calories to help heal the area, additional hydration to prevent kidney failure, and it's pretty much always going to cause some severe scarring. The really unpleasant thing is that this is going to require something called debridement, which is where they cut the dead tissue away. And that's because there's a particularly nasty infection that can occur in dead tissue from wounds like that. It's called gangrene, and you can die from it. And so they have to cut all that dead tissue away before it gets infected. And they can't leave dead tissue, so they have to err on the side of living tissue, which doesn't feel very good. So we can measure the severity of burns by the rule of nines. And let me back up just a second here and talk about the third-degree burn. There is no stratum basale here. So what is the epidermis supposed to grow back from? Well, it can't. There's nothing for it to grow back from. And so this is going to require a skin graft. So they're going to have to take skin from another part of the body, causing a surgical wound on that site, and then place it down on top of the hand here and try and get it to stay. So back to the rule of nines. This is for severity of burns. Basically, we've chopped the body up into 9%. So the front of one leg is 9%, the back of a leg is 9%, the front of one arm is 4.5%, the back of one arm is 4.5%. So an entire arm is 9%, whereas half of a leg is 9%. The trunk, the anterior trunk is 2 nines, the posterior trunk is 2 nines, the head is 4.5%. And when you add all of these up together, you get 99%, and then the perineum is 1%. Try not to burn your perineum. But if somebody says they had, say, second-degree burns across 40% of their body, that's how they figure this out. So treatment for burns is managing fluid loss. Because we've disrupted the cutaneous membrane and it can no longer keep fluids in, they're just going to literally ooze out of the body. Burns will what we call weep. You can lose a tremendous amount of water this way. And so these people have to be put on IVs or encouraged to drink massive amounts of water. There's going to be swelling, of course, from the damage, and that can be managed with anti-inflammatories. Burns, the second-degree burns, can be extremely painful, and so that needs to be managed. The debridement of the dead tissue, and hopefully there won't be an infection. If there is, it needs to be treated aggressively. And then, of course, the increase in caloric intake to make sure that enough raw material is present for healing to begin. Burns are considered critical if more than 25% of the body has second-degree burns, or if more than 10% of the body has third-degree burns, or if the face, hands, or feet have third-degree burns. That's because you breathe and eat through your face, and then you do everything with your hands, and you have to use your feet to walk around on. So all three of those areas are really, really critical, and if any of them have third-degree burns, they take extra special care to treat, and people will be moved to a critical burn unit.